चलिए आगे बढ़ते हैं। वैक्सीनेशन की समस्या केवल राजधानी दिल्ली तक ही सीमित नहीं है। तमिलनाडु में भी कुछ ऐसे ही हालात देखने को मिल रहे हैं, मगर यहाँ पर तमिलनाडु में लॉकडाउन लगने के 10 दिनों बाद भी लगातार कोरोना के मामलों में बढ़ोतरी जारी है। पिछले 24 घंटों में की अगर बात की जाए तो कोविड-19 के 35,000 से ज्यादा मामले सामने आए हैं पूरे राज्य भर में। लेकिन चिंता और हैरानी की बात यह है कि अभी तक केवल 46,000 लोगों का ही टीकाकरण हो पाया है। आंकड़ों की माने तो तमिलनाडु के 10 जिलों में 20% से भी ज्यादा पॉजिटिविटी रेट है और रोजाना 1500 से ज्यादा कोरोना के मामले सामने भी आ रहे हैं। और चेन्नई को छोड़कर इन जिलों का टीकाकरण बमुश्किल 14% को ही पार कर पाया है। मुगिलन हमारे साथ जुड़े हैं और ज्यादा जानकारी लेकर। मुगिलन, गुड मॉर्निंग। Any which way we have been seeing that Tamil Nadu has been lagging behind when it comes to vaccination, and now these 10 districts are posing a big problem for the state. Why exactly the vaccination rate so low in these particular districts?
Definitely, we have seen right from the starting, Tamil Nadu had the vaccine hesitancy, and only very limited number of people coming forward to take up the vaccine. In the month of April, we have seen the vaccine on a daily average, people almost touching 1 lakh beneficiaries coming out to take up the vaccine. But now, yesterday, we are seeing, or at least in last few days, we are seeing the numbers have not 50,000 all around the state. And what's more worrying is that we know Tamil Nadu is now reeling under a very high surge of COVID positive cases. Yesterday, 35,000 cases was reported, and more importantly, earlier we used to see this kind of trend only in Chennai and in the neighboring districts. But now, in the second wave, we are seeing at least in 10 to 15 districts, the numbers are going up. More than 1,500 cases are being reported in rural districts also. So when we access the data that was provided by the health department, that is the positivity rate and the vaccination in particular districts, it seems to be completely inversely proportional. Because when we take Theni, for instance, that is Theni has the positivity rate of 29.1%, but their vaccination percentage seems to be only 4% of the entire population in the district have taken the first dose, and when it comes to second dose, it's only 1.5% of people who have taken their second dose of vaccination. And when we speak about Ramanathapuram district has positivity rate of 24.2%, and there the first dose of vaccination percentage is only 2% and the second dose is only 0.7%. So yes, there are these are the 10 largely affected districts in Tamil Nadu, and in these districts we are seeing very abysmally low vaccination percentage. Either it be the first dose or the second dose, the percentage have not crossed even 5% in maximum of these worst affected districts. And yesterday, yes, we spoke with the health secretary, we spoke with the health department and asked them the reason why the vaccination is completely low in these worst affected districts. And what we could hear from the health department secretary and the health department is that initially, yes, there was vaccine hesitancy, but now people have understood the seriousness and coming forward, but there is no supply from the central government is the word what we could hear from the health secretary. So now, even though people have started coming forward to take up the vaccine, the supply of vaccine seems to be a problem. Yes, in all these worst affected districts, the vaccination percentage is below 5%, and it seems to be another worrying factor for the health department officials.
It is a very big concern. Really sorry, Mugilan, I have to interrupt you. I am running short of time, but thank you for all those details.